Today we are going to talk about hypertension. High blood pressure is a very common problem and we often get it wrong. So let's see what is the right way of dealing with hypertension.
Hello, this is Dr. Anirban Chakraborty. I'm a consultant physician and diabetologist, and I have special interest in lifestyle medicine. Did you know that small changes to your lifestyle may bring big impact to your overall health? I make regular videos to give you tips and tricks so that you can make minimum changes to your lifestyle to have the maximum outcome. So if you are struggling with your health and are fed up of taking medicines, I hope you'll find my videos useful.
Welcome back. So let me start with two pieces of good news. So the first piece of good news is that although you may think that you're hypertensive, actually you may not be hypertensive after all. And I'll elaborate on that. And number two is that even if you have hypertension, you may not need any medication because you can cure your hypertension if you follow some lifestyle advices. Okay, so let's talk about number one, whether you are actually hypertensive or not. So it all depends on what your blood pressure readings are, right? So when you check your blood pressure reading, you may or may not get the correct readings. So it's very important that you know how to get the correct blood pressure readings. Otherwise, you may have falsely elevated blood pressure, and based on that reading, your doctor might start you on some medication because the doctors know that persistently elevated blood pressure can cause a lot of problem. So how do you measure your blood pressure? It's very important that you do not check your blood pressure when you're stressed. So for example, if you have just rushed to your doctor's chamber and you're very anxious whether you'll be there on time or not, or you're anxious whether you have got some serious ailment or not, at that time checking blood pressure may not give you the right reading. So it's important that you calm down, sit in a very quiet place for at least 5 minutes, get your heart rate down, get your nerves settled, and then check your blood pressure. When you check your blood pressure, it's very important that you sit upright with both of your feet touching the ground and not hanging. It's very important that you choose the right size of cuff to check your blood pressure. So if you are overweight, for example, or if you have big arms, you may need a larger cuff size. So after choosing the right cuff size, you need to make sure that the machine is at the level of the heart and not above or below. And then you check your blood pressure. Some people advise that you check 3 readings at least and take the average of those 3 readings, or some people advise that you ignore the first reading and take the average of the second 2 readings. And this is how you should keep checking your blood pressure at home. It's important that you check your blood pressure at home at the same time every day. You can do it every morning after you get up, relax, go to the bathroom, and then come back and sit down, relax for 5 minutes, and then check your blood pressure every day if you want to. If your blood pressure is within normal range, there is no need to check it every day. You can check it periodically, and you can reduce the period of checking if your blood pressure readings are almost the same as before. So if you do your blood pressure readings this way, there's a big chance that your blood pressure readings will actually show that it's not too high, and therefore you may not need to carry on with all these medications. So get your blood pressure checked properly. That's number one. The second way how we can have abnormal reading is what we call white coat hypertension. I alluded to that already, that if you're rushing to the doctors, you can occasionally have an abnormally elevated blood pressure. But there's a condition called white coat hypertension where a patient who is very anxious or stressed, whenever they see a doctor in a white coat or even otherwise, their blood pressure shoots up. So again, you need to calm them down, make them do some deep breathing. For example, I've talked about deep breathing to address your anxiety in another video, but essentially you need to calm yourself down and then check your blood pressure. But often white coat hypertension is best diagnosed by doing a blood pressure test called 24-hour ambulatory blood pressure monitoring, or 24-hour ABPM. If you check your blood pressure at home and it goes up and down, it's a good idea to get this average blood pressure checked and see if actually your blood pressure is on an average high, or is it high under certain stress factors when you are worked up or when you're anxious. So by following these two things, get your blood pressure checked properly and get your blood pressure checked over a 24-hour period, many high blood pressure patients can actually find out that they do not have high blood pressure. The problem with not diagnosing high blood pressure properly is if the doctors put you on some medication to lower your blood pressure, then when you are not stressed and when you are relaxed, your blood pressure can be actually abnormally low, and that can make you feel giddy or even collapse. We have seen that in the Western world, in the elderly population, this is perhaps the commonest cause of fall and hospital admission, which is overtreated hypertension. So be very careful that you actually have high blood pressure over a sustained period of time before you start your medication. Now let me go back to the second good news that we talked about, which is that even if you have high blood pressure, in many cases this can be corrected by making small changes to your lifestyle. So what do I mean by that? In general, a systolic blood pressure, the upper reading of about 140, is considered to be normal unless you have got some other problems like a chronic kidney disease or cardiovascular disease, for example. But any blood pressure reading of between 140 and 160 is not that dangerous, provided you try to change your lifestyle and try to get your blood pressure down. Anything above 160 persistently will definitely need treatment, and anything more than 180 will definitely need urgent emergency treatment at your nearest hospital. So if your blood pressure readings are consistently between 140 and 160, what are the things that you can do to try and get it down? Number one, address whether you actually are suffering from anxiety or not. If you are, then you may have to do some meditation, deep breathing, relaxing technique before you check your blood pressure so that you are getting your true blood pressure reading. Occasionally, your doctor might ask you to get a 24-hour ABPM, as I already mentioned. Still, if you are diagnosed to be having a blood pressure of between 140 and 160, then the things you can do is, number one, if you are overweight, try to cut down your weight. If you can manage to lose about 10 kilos of weight, then your blood pressure, systolic blood pressure, will on an average come down by 10 millimeter mercury, which is almost as good as any of the top line blood pressure tablets. It's amazing how much your blood pressure can come down by if you lose weight. That's number one. Number two is you need to cut down the amount of salt you take in your food. And by this we don't mean added salt to your food, we just mean any salt in your food. So any processed food, any packaged food will have a lot of salt in it. So do check the food labels to identify how much salt you've got in your packaged food. Do count the salt you add to your cooking. On top of it, if you take any extra salt while eating, you should count that as well. In total, including all of these salts, your intake should not be more than 5 grams a day, which is just a small teaspoon. So on an average, we take at least 10 times of that salt every day. So there's a lot of scope for improvement. The more salt you eat, the more water it'll take with it, and the pressure inside your body will increase. So cut down the salt. Next thing what you can do is you can increase potassium. So sodium in salt is harmful, but potassium is very, very helpful. It helps you relax your blood vessels and therefore get the blood pressure down. So fruits and vegetables are generally very high in potassium, so try to have more fruits and vegetables in your diet and less salt. There's a diet called DASH diet, which essentially suggests that of your plate, half of that should be vegetables, 1/4 should be rice or roti, and the rest 1/4 should be animal or milk protein if you're a vegetarian. So essentially have half of your plate of vegetables and fruits, and that should give you enough potassium to get your blood pressure under control. Next is very important, is to do some exercise. When we talk about exercise, we talk about high intensity or moderate intensity exercise. For example, if you are doing brisk walking, light jogging, things like these are moderate intensity exercise. You should try to do at least 30 minutes of these every day. And if you're doing high intensity exercise where you are doing fast running, singles tennis match, swimming, etc., then you can do 30 minutes of this at least twice a week, and that should help you get enough exercise for your cardiovascular protection, and that should help you getting your blood pressure down. Next is, if you are a smoker, you obviously need to stop smoking. Cutting down is not that useful. Stopping is what you need to do, because any amount of smoking is very harmful for your cardiovascular health. Also, you should try and sleep well. I've made a video on how you can sleep well, so try to follow the sleep hygiene that I talked about in that video, and good sleep will help your blood pressure control as well. Overall, it's very important that you are not overweight and you're having healthy food. And even if you have slightly raised blood pressure, with these small changes, I'm sure your blood pressure will come down naturally. So the patients we see in our diabetes and obesity reversal program, while they lose their weight, they improve their type 2 diabetes and they improve their hypertension as well. So many of these patients actually manage to come off their diabetes and blood pressure tablets. So I'm sure if you follow these simple tips and try to lose the extra weight by eating healthy, doing a bit of exercise, I'm sure you'll see a lot of improvement in your blood pressure without the need for too many medications. Take care.